Our research here in Ontario showed us that 1 in 2 adults with developmental disabilities are going to be going to the emergency department in a 2-year period. So I think about that in 2 ways. If every other person with a developmental disability is going to go to the emerge, that's a problem that we really want to prevent. So thinking about prevention, how we can help people with developmental disabilities not go to their emergency department, there are a few things we can think about. 1, we have to give people the support that they need. We found from our project that people who were under-supported, maybe not getting the professional support, the hours of staff doing things with them that were interesting, that were helping them get what they needed to get done, those people were more at risk of going to the hospital than people who had those supports in place. Another really crucial factor is primary care. Our project found that people who did not have good primary care were more likely to go to the emergency department. We need to make sure that people with developmental disabilities get the medical care that they need to recognize problems, pain, simple things, constipation, sore toenail, abscessed tooth, all those kinds of things need to be taken care of and screened and monitored so people are healthy and comfortable and happy. And if they're not, they're going to be at risk. The third area that really predicted who went to the emerge versus who stayed home was who had a crisis plan. So if you're a person with a developmental disability having some difficulties, you need to know what kinds of things to do when you have a difficulty so that you don't end up going to the emerge department, or that you go because that's what your plan says you should do because you've tried the other things and they don't work. The other way of thinking about people with developmental disabilities in the emerge is that if 1 in 2 of these individuals is going to go to the emerge in a 2-year period, we can't just prevent it, we have to start planning and preparing for it. Going to the emerge might be as common for some people as going to the doctors. If you're pregnant and you're having a baby pretty soon, you have a bag packed, ready to go, so that if you go to the hospital, you know what things are there for you. If you have a developmental disability and it's possible you're going to have an emergency and you need to go to the hospital, you want that toolkit packed, ready to go. So there's a few things you need to think about having with you that will make a difference. You need to have information, crucial information that's going to help them at the hospital take care of you and meet your needs. You need medication information. What are you taking right now? How much of it? It should be written down. It could be printed out from your pharmacist. That should be written down on a piece of paper, along with information about who your care providers are. Who's your primary care doctor? What kinds of clinical providers are involved in your care? What's your family information if you want family to be contacted? Also, you want to make sure that this kind of document, so we call that like an emergency plan or an emergency information sheet, don't just have that on your person. You also want to make sure that that is at the hospital. Because sometimes people go to the emergency department and they don't have a chance to grab their bag or grab their toolkit. So if you contact the hospital and you speak with a crisis worker, you can find a way to get that plan on file at the hospital so that if you're there, or if someone you love with a developmental disability goes to the hospital and you're supporting them, you know the hospital already has that information. And when you're making up that kind of plan or that document, that piece of paper, it doesn't hurt to work with the hospital to think about what would work for them. So instead of you walking in there and handing them a sheet of paper and saying, do these 3 things, this is what we think is in our plan, ask the hospital what would work. And then it's a collaborative plan you've worked on together. And they're a lot more likely to be able to follow through with what's written on that piece of paper. Another important thing to think about if you're going to the hospital is that there's going to be things you're going to need. You're going to have to wait. And it's not just because people with developmental disabilities have to wait a long time when they go to the hospital. It's because everybody has to wait when they go to the hospital. If there's something that's more urgent than your situation, you don't get bumped up to go at the front of the line. It could be 2 hours, and sometimes from start to finish, it could be 12 hours. So what kinds of things would you need to be comfortable if you're going to be in the hospital for 12 hours? You might need some food. You might need something to drink. You might need things to do so you don't feel bored. Okay, so thinking about a care kit, a toolkit that we're going to bring for people with disabilities to the hospital, we should have some of those activities to keep them engaged and to keep them feeling comfortable. And if you're the caregiver and you're also going to the hospital, then you need things to keep you engaged and to keep you comfortable. So packing those things is really important. Sometimes the food that's available at the hospital is not very good. If you're fussy about what you eat or what you drink and there's something specific you need, make sure you've got something like that in the car. Make sure you've got something like that at your front door so you can grab it. Another really important thing that you're going to need if you're going to the hospital is you're going to need to have documentation or a way of showing what your situation was like when you're not in crisis. So having information that kind of shows, it could be something written, better yet it could be a digital something that's on the iPhone that shows what things are like when things are good. So when they're assessing you, when they're interviewing you at the hospital to find out about your situation, they can see what's going on now, but you can also show them a quick clip of what was going on before, or maybe how things were in a different situation. That kind of visual strategy can also be a really helpful way for someone with a disability to talk about their situation, because they've got that visual to kind of go with telling the story. And then the doctor and the patient have something they can talk about together. So it's a collaborative process that helps inform that assessment.